My name is Stephen Johnson, Dr. Stephen Johnson. I'm a radiologist in the United States, specialty in MRI scanning. I've been in this business since 1987, and I'm at my home here. It's February 14th, Valentine's Day. I'm just warming up here, and I'm going to go in and do a little bit of work. And I'm going to tell you and show you why I can do this kind of work in my home. But first of all, my wife asked me to clean the snow off the driveway. Of course, when there's snow on the driveway and snow on the roads, it's dangerous to move around, slow to move around, and that are compelling reasons to be able to work at home. So I won't bore you with all the snow shoveling, and I'll go inside here and show you what I can do after my little warm up here. I live out in the rural portion of the outskirts of the Twin Cities, Minneapolis, St. Paul. But I do have good internet service, which is the key to life. Come on in. So what happens in medicine is imaging technology gets more sophisticated and faster, and its implementation is limited by socioeconomic means, but it's an inevitable process. And the ability to manage that data with the internet now has created an entirely new environment for the healthcare service provision throughout the world, and it's only going to reach to more remote areas with higher levels of expertise and impact populations in a positive fashion. A trend I think that is inevitable. It's amazing to me now at this point in my career. I have to tell you that the sophistication of treating patients with biologics and chemotherapeutic agents is dramatic. 5 years ago, there's nothing but death march, death sentences. And now you get dramatic responses in these tumors if only for 6, 8 months or 18 months, gives people a big chunk of life at the end, which they didn't have before. Inherent in doing teleradiology is to have the functionality and the feature in your viewing technology so that you can manage the interpretation of your images. But more subtle than that is the level of technology that you use. There are various levels and designs of technology to make the transfer of images faster and their manipulation and processing quicker, or be able to be spread to a larger cadre of interpreters and have broader interactions. So I can only say that in this sophisticated environment, it behooves you to make sure that your technology platform that you choose is one that is state-of-the-art and also can be upgraded to any new state-of-the-art in the future as things are developed. So what I propose, or what I am strongly in favor of, is a networked system where you can network as an organization, you can network between organizations, but you have the ability to do high-level interpretations in a very efficient fashion to get that information out to the physicians and their patients, because that's really what our goal is. Diagnostic information that gets into the hands of the decision makers to expedite care and increase the efficiencies and the productivity of the imaging environment. Working as a radiologist on the internet and at home, you want to be careful you don't get into a caveman modality where you're isolated. You need a technology platform that then allows you to interact with your colleagues, both to get help with cases you may be unsure about, or to interact with your clinical colleagues that have specific questions regarding the images and their subsequent care of their patients. So what I am going to do now is help a friend of mine, Dr. Senor Mendez in Mexico City, and we're going to pull up a case. Senor Mendez, are you there?
Hola, Dr. Johnson, ¿cómo está usted? Saludos desde la Ciudad de México.
Bien, muchas gracias. What can I do to help you today?
Well, I'm here. I need some of your clinical expertise. I have this patient that I would like to know about how severe the L4 to L5 is, and I need to know if there is a herniation in these parameters.
Well, let me pull up an image here and we can take a look. What I'm doing here is pulling up the sagittal images, and we can scroll through, and you can see on the sagittal image how this disc has pushed back in subligamentous space.
Well, I would like to know if there's any nerve roots compression.
To see the nerve roots, I think we're going to want to look at the axial images here. So we'll go back and look at the L4-5 level, which is right here. We can see the nerve root in the thecal sac here, and right here the disc is impinging on the lateral recess regions on both sides, the L5 nerve roots. So I would suspect if your patient is having pain down the front side of their legs, this is the culprit.
Okay, well, thank you for your help. I really appreciate that, and I will have to give those news to my patient. And thank you, and I hope to see you soon in Mexico City. Adiós.
Muchas gracias. Hasta luego.
Hasta luego.
So you've seen how work lists can be used to access patients, open patients, look at their images, interpret their images, create reports. But we're sending that back to the work list that then becomes a compendium, a large feature set product. So in this feature set, you can use it to schedule patients at facilities or multiple facilities over a wide area. Again, the imaging information and reports go back to the system. You then have an EMR, electronic medical record functionality, that can compile the patient's other data, be it laboratory, sleep apnea studies. Physician that can then collate all that data, create a narrative in the electronic medical record that's available for the patient, or set up plans and treatment plans and further therapies. Aside from just single patients, you then have the ability with this kind of technology to compile data from a population. All the patient's data, images, electronic medical records can be compiled, and you have the ability to research that data in a big data analytics fashion and pick out best practices, most effective treatment protocols for any individual disease states that you may be interested in. In this healthcare reform environment, this is extremely important in the West and probably will become more important in the developing world. Well, one of the last steps in the process now is to allow not only physicians to get information from their patients, but also the patients to get their own medical information, be it on a laptop, a mobile device, but we want to make sure it's secure. So we're going to show an example of voice biometric secure access provided by Voyageur Technologies.
Please say, never forget tomorrow is a new day after the beep.
Never forget tomorrow is a new day. And it looks like I don't have pneumonia after all.
I just want to finish up by saying how important it is in the world of Wi-Fi and high-speed mobile networks that your technology not only can follow you to your home or where you work on the internet, but follow you in a mobile fashion wherever you may travel. What you can do here is look at images on a tablet that's connected to Wi-Fi or on a phone that's on a cellular network, which means in the end that you can have professional interpretive service response to important images for your patients, wherever that professional is or wherever that patient is. Be they sitting in a living room in Minnesota, in Mexico City, or sitting in a refugee camp in northern Kenya, or in a beautiful lush garden in Kuala Lumpur. Thank you.
Like many of the great advantages and developments in life, they have their own hidden pitfalls. So as you can work at home and enjoy yourself and your environment, they can find you at home. And at 2 o'clock in the morning, a cup of coffee, your pajamas, you're back to work. But it's still better than a drive.